So let's get into chapter 14. Who's hungry? Because this is all about food, right? And this is right before lunch and the whole bit. However, are there times when you cannot swallow food and you cannot eat things orally? And that's the situation we're talking about, is that this whole thing is about the calculations and the formulation of a TPN. So what does a TPN stand for? Total parenteral. What does parenteral stand for? IV or intravenous, so total parenteral nutrition. That means everything that you need to get in a day's amount of food and calories and everything has to come through an IV bag. So just to be clear, when would that normally be the case? Usually it's when there's some sort of surgery or trauma to the gastrointestinal tract. So if they have to go in there due to maybe cancer or maybe due to ulcerative colitis or something where they have to go and do some bowel surgery and they actually have to do an operation for whatever reason on the bowels, they stitch it all back up, what do they have to let the bowel have time to do? Heal and recover. And so if that's going to take 3 days or longer, then they're going to go ahead and put somebody on this total parenteral nutrition so they don't starve to death while they're waiting for their GI tract to heal well enough to be able to put food back down it. All right. So that's typically what we do in hospitals. Is it's usually short term during recovery. Now, can there be some long-term issues where people have enough of their bowel resected for whatever reason that they have to always be on TPNs? And so yes, there are some longer term TPNs. Those aren't the normal. Usually, and what we're going to focus on are kind of the short term due to some sort of surgery thing. So even before I go on though, just because the whole point, the calculations are a piece of cake. This is not a calculation real problem. I will give you all of the formulas you see would be on the exam, but that still means you have to calculate them right. So it comes down to computation and making sure you put the right numbers in to get them out. So that's not difficult. But just to think about it, if we're going to blend up everything you would need to eat for a day and put it into a bag, what would need to be in there? There would need to be fluid. Would you think about that? So think about all your big water bottles in front of you. So if you can't take anything by mouth, that includes water or fluid, so you'd have to get your daily fluid needs. You would need all of your calories and all of your protein would need to come through that. And then the electrolytes, the sodium, the potassium, the calcium, things that go out in your urine because your body just loses them, we're going to need to replace that as well. So there are multiple ingredients that we have to put into this one bag to give somebody everything they need for a day. So let's start with this. And again, you can watch me a little bit, or if you got your calculator out, some of these calculations are quick enough for you to be able to do as we kind of tell our story along. So let's see if you can keep up with me and do this. So the story starts with MJ as a patient who is admitted to the hospital needing a severe bowel obstruction. So due to they're going to have to go do some surgery to remove the obstruction. They sewed it all back up, so he'll be fine, but we don't want anything to go through the GI tract for at least a week. So we don't want him to starve to death, so we want to start him on this TPN. All right, things we need to know about MJ is that he's a 48-year-old male. Gender gets to be important here in a minute. So we have 48 years, he's male, weighs 220 pounds, and stands 5 feet 7 inches tall. So those are some of the demographics. All right, remember the whole idea here is we need to feed him. Should everyone always eat the same amount of calories? Look around, we all have different shapes and sizes and everything else. Should we all have the same amount of calories? No, usually though, a lot of the calories is based off of weight. But what we want to do is feed somebody the weight that they need metabolically, that are active. So again, you want to feed their organs, you want to feed their muscles, but are there something that some people have that are kind of metabolically inert and probably shouldn't be used to base the caloric content on? I'm a good example of that. Is there some sort of tissue that some people have that you should not base your calories on? Fat. So we need to make sure we can kind of come up with a lean weight. So we do feed the parts of the person's body that needs calories, but we don't overfeed them by giving them weight-based issues for fat that doesn't need the calories. So there's a lot of work here to come up to the right weight. So question one, all of the little sub-steps are all about finding the most appropriate weight to base our feeding off of. All right, so let's start with the actual body weight, ABW, actual body weight. Simply convert his 220 pounds into kilograms. So hopefully you can do that quickly, and hopefully maybe did that while I was talking. But that's straightforward. So again, we said he's 220 pounds, and there's 2.2 pounds per kilogram. So we're starting with an actual body weight of 100 kilograms. Is that fat? Not for somebody who's 7 feet tall, would you agree? But if you're 4'2", that might be a lot of weight. So we need to do some more understanding. We can't just go off of a weight and make a decision about whether that's obese or not, or having excess fat. So we got to consider the weight along with the height. So we're going to do a couple of different calculations here, a couple of which we need their height in centimeters. So do me a favor and convert their 5'7" down into centimeters. So again, the conversion is there. This is something we've all, hopefully, working through as I've talked. All of step one are all things we have done, because many drugs dosing off of a modified weight, not just always actual body weight, whether it's because of obesity or body surface area or something else. We know that drugs can be dosed off of different sorts of issues for a patient. In this case, we said he's 5 feet, which is actually 60 inches. 5 times 12 is 60. We add this 7 inches to that, so 60 plus 7 is 67 inches. We can multiply by 2.54, and we take and get 170 centimeters. All right, and we're definitely going to need to remember that for later. So make a mark of that. That's not going to change. His real height is 170 centimeters. All right, now this was just practice. Calculate the body surface area, because you have a weight and you have a height in centimeters. So quickly, I'll give you a minute here. Let's see if you can correctly calculate a patient's body surface area. These skills will never go away. You need to be able to do these. So given the 100 kilograms and the 170 centimeters, can you correctly and quickly calculate their body surface area? Did you get 2.17? Hopefully, you can see where I did my math along the way there. So that's good. So body surface area is certainly a way that we can describe somebody's height and weight kind of combined. Not something we do for TPN. That was just for fun. What we need to maybe do more of and worry about body surface area is determine whether that 100 kilograms is obese or not. So the other thing we've done previously is use the body mass index, or BMI formula, help us determine. And you can see its interpretation is here. So let's calculate it using their weight in kilograms. And keep in mind, you have their height in centimeters. So convert 170 centimeters to meters, and then you can plug it into the formula and go ahead and calculate for me his BMI. And once you have it, go back and use this to assess whether he's normal, overweight, obese, or extremely obese, using those cutoffs and using the BMI to help us decide whether, for his height of 170 centimeters and his weight of 100 kilograms, his degree of obesity. Hopefully this doesn't take you too long at this point. We know we have 100 kilograms. The trick was to take 170 centimeters and know that there's 100 centimeters per meter, so we need to divide by 100. So 170 divided by 100 is 1.7. So that's why it's 1.7 meters, and 100 kilograms in the numerator. Divide that out, and I got 35. 35 interprets right into here, which would be considered obese. So that is concerning. So I don't think we want to use 100 kilograms for their feed weight. So to figure out a better way to use, we're going to start by calculating their ideal body weight. And again, this is where you've seen these things before, but you're going to see this through all this lecture, is that there are some formulas that are different by gender. So make sure you use the correct gender. Since this is a male patient, make sure you use the correct male formula, but go ahead and calculate an ideal body weight. Again, this won't be their final body weight, but it's going to be where we start from. So we're going to need to know their ideal body weight. Did you get 66? Right, so we're saying an estimate for him based off of his height on average for a male without any additional fat would be 66 kilograms. So we can also use that, and we'll do this in lab when we do our renal dosing next year. Another way, instead of calculating BMI, another way to estimate the degree of obesity or how far overweight somebody is to simply look at their actual body weight divided by their ideal. All right, so if you were exactly at your ideal, you would basically, actual divided by ideal would be 1 times 100 would be 100%. So if you're at your ideal, you're at 100% of your ideal. The more over the ideal, the higher your weight is relative to your ideal, then the higher that percentage goes. All right, so let's go ahead and take his 100 kilograms. Remember, he was 100 kilograms, and we just calculated 66 kilograms. So what is 100 divided by 66 times 100? That converts it to a percent. So try that and see if you get my same number here. But then that percent, you can say, okay, what's acceptable? You don't have to be at your ideal, but we basically say, and in lab we cut it to 130%. If you're between 100 and 130%, you're within a normal weight range, meaning anywhere above ideal, up to no more than 30% over that would be considered normal weight, but over 130%, there gets to be extra fat, and that fat is something that we're not going to want to consider in our feed weight. Since this person's 152%, that kind of puts it right there between overweight and obese, so again, we definitely want to do something. So what we're going to use, and this is the final answer, I'm sorry this took a little while to get to this one, but the weight we want to feed this person on is going to be an adjusted body weight, because we have concluded that he is obese. His weight for his height is in the obese range. So let's calculate an adjusted. Do you remember doing this before? Can anyone tell me how this formula is different than what we did in chapter 7, 8 when we practiced this? This value right here, okay? Previously, we used a value of 0.4, and you will see that a lot with renal dosing, where you'll use 0.4 as the factor to increase the ideal body weight by. But for feeding and for nutrition, that overfeeds people, so they lowered this adjustment down to 0.25. So go ahead and use the formula, and again, I will tell you on the test, I'll provide you the formula. You don't have to know that, but if you were wondering, yes, sometimes you can have differences in how you calculate adjusted body weight based off of this factor right here, and for nutrition, the standard is 0.25. So do me a favor, as I'm talking, go ahead and calculate. We know his actual is 100. We calculated his ideal to be 66. So can you subtract those? Take 0.25 of that difference and add it to the 66 and see if we get the same number. And this is the number we need to remember for the rest of this lecture, because this is our feed weight. What we are now calculating is the feed weight. Since we've decided he is obese, we want to base the feed off of the adjusted body weight. And when I did that math, I got 75 kilograms. Did you all get 75 kilograms? Okay. So from here on out, even if you don't remember anything else I just said, remember from here out, we have made the decision. All of this step one was to decide what weight to base his feeding on. Okay, so we are going to feed 75 kilograms. All right, let's talk about feeding. So first thing we got to do is determine how many calories, his caloric needs for the day. And we always do it on a per day basis. So we're calculating daily caloric needs. It's a two-step process. You start by calculating what we call the basal metabolic rate, okay? So, and there's two different formulas for doing that, but let's make sure you understand. The basal metabolic rate is not the final answer, because it's the amount of calories you would need if you laid in bed and did not move and simply breathed and did that for a day. It sounds like me on the weekend. But anyways, if that's all you did, that's your basal metabolic rate. But most of us are more active than that, right? So we're going to take that BMR and we're going to multiply it by a factor. I'm going to call it a stress factor. And you can see the degree of medical stress will increase the amount of somebody's calories that they need, because they're needing to make new proteins, they're needing to fight off an infection, whatever is going on with them, they're going to need more calories than the basal. But the formula starts with just calculating the basal. And of course, to make it more confusing, there are two versions of the same thing. You can calculate a BMR using the Harris-Benedict, which we then call it the basal energy expenditure, or there's a newer one that's we're going to ultimately use, which is the Mifflin-St. Jeord version of that, which we call a resting energy expenditure. Either way, just realize this is one formula, this is a different formula. In the end, you have to choose one of those to use. But remember, then you always have to adjust it using the stress factor, all right? Let's just do it. So here is the Harris-Benedict, and you may have done this in some of your chemistry class, since this has been around for a long time. I will warn you, and I'll give you some time to work on this here. There are remember, there's two different genders, so make sure we use the male. We still have a male patient here, but use their weight in kilograms, use the feed weight. Remember, from here on out, we'll only ever use that 75 kilograms. Remember, you calculated the 170 centimeters, and we know that he's a 48-year-old patient. So the hardest part of this on the test, and I do put these on the test sometimes, is simply I'll give you the formulas, and you have to be able to correctly calculate the BMR, okay? And not that it's mind-rending, but are there some things that you add and some things that you subtract? I'll warn you about the negative sign there. Remember, you subtract at the end. And again, this is always a gender problem. Look up here. The difference in genders is that males start with 66.5. What do females start with? 655.1. Do you see where it would be easy to confuse those numbers? So again, just carefully use the correct formula. Calculate for me his, I emphasize his, BMR using the Harris-Benedict equation. Happen. But hopefully it didn't happen to you. Did you all get 1624 at the end? 1,624 calories. That's what I got from using this formula, and you can see my work there. All right? So all of those factors go in to determine a basal energy expenditure that this person would have. Now we need to adjust it, because what we ultimately want is their total daily energy expenditure, the TDEE. That's the amount of calories we want to replace. It's going to be equal to their basal metabolic amount that we just calculated times, as I mentioned, the stress factor. And look at the stress factor. You can see the more stressed somebody is, the more medically infirm that they are, if you will, the more calories they're going to need to heal themselves, the more tissue regeneration. So what's the one at the bottom, the worst one? Burns. Picture somebody in a burn unit where they've got burns over whatever percent of their body. They have to regrow all of that tissue. They have to fight off infections. They have all of these things their body is trying to recover from. It takes a lot of calories to do that. I would argue our patient is right here in the 1.3 category because they're in for some surgery. So they're recovering from a standard surgery. So they need a little bit more than the normal amount of calories to help that promote that regrowth and regeneration and the healing of their bowel and their tissues. So let's use a stress factor of 1.3. So it's easy. Just take what we just calculated and then multiply that by 1.3 to come up with our actual caloric target, our TDEE, the total daily energy expenditure that we want to target for this patient. If we were to use that formula, it would be 2,111. Okay? We're going to see where that comes from. Now, just to make sure this makes sense, have you ever looked at the nutrition labels on boxes when they give you, like, for the calories and so forth, what percent of calories? Do you remember on average what they say an average number of calories per day is? 2,000, right? So do you see where we just calculated that? I mean, that number should be realistic. It should be the calories per day somebody needs. All right. That's not what we're going to actually use going forward, though, because to be honest with you, they prefer now this Mifflin-St. Georg formula because, as you'll see here, it is a lower number. They think that the Harris-Benedict formula overestimates and overfeeds people. So let's actually do this formula now. So go ahead and repeat your calculation using this formula. You can see it's similar in that it uses the same factors, but clearly the numbers are easier. Students generally do better in terms of doing the right math here, but don't forget there is still a subtraction, and then the numbers at the end are very different depending on gender. So you always need to make sure you use the right gender formula. But the math generally to solve this is a little easier, so try it. Let's see, you're doing the same step, but we're now calculating the basal metabolic rate using the different formula. So you get 1578, or 1,578. So again, that's the basal. We'll use the same exact stress factor, so we're still the surgery patient here. So now we get 2,051. So do you see where that's about 100 calories or so, a little less than 100 calories difference, but it's less. So this is our caloric target. So circle that, or make sure you make note of that. That's the number we're going to also take forward. So what we want to provide the person is 2,051 calories per day. Now, let me just be clear. I say calories, and I will continue to say calories, but the actual units are kcal. What does kcal stands for? Kilocalories. But so we never have to change that unit. So we're never going to go from calories to kilocalories or anything else. The units truly are kilocalories, and if I say calories, I really am implying kilocalories. Okay? Well, we're in good shape now. So I know how many calories I need. So let's determine our targets. Our targets are going to be how much fluid he needs per day. Think about this. So we talked about fluid, how much protein, and then how many calories. We need to provide calories, protein, and fluid. Okay, outside the electrolytes. 3 targets. So let's do it. Easy breezy for the fluid, the easiest one. There are just numeric formulas for estimating how much fluid an average person needs per day. So go ahead and remember to always use the feed weight. Using his feed weight, calculate for me. This is just a test. Can you use the formula correctly and get the correct total daily fluid requirement for this patient using this mathematical estimate? And certainly this is not the only formula that's used to estimate fluid volume, but all of them use some sort of numeric formula to calculate it. You get 2,600, 2,600 milliliters per day. This is a good one to just ask yourself, okay, if I calculated 10,000, and something. Would that be a reasonable amount of fluid to suck down in a day? Would that be, I mean, use your kind of try to visualize here a little bit. It should be about how much fluid somebody needs in a day. So it should be a reasonable amount in that sense. So in this case, 2,600 milliliters per day. Target number 1, yay. We'll come back to that. That's an important number we'll need later. But now we know how much fluid. Now let's talk about protein. And again, there are simply just numeric estimates of how much protein per day somebody needs based off of their degree. So here's the deal. We want to replace the protein for the body to use it to regrow and reheal its tissue. All right? We don't want it broken down for calories. We want it to be used so that it can use them as building blocks of proteins and proteins to be used in healing skin, or in this case, the GI, the bowel, whatever it is. So again, you can see the more stressed they are, the higher the number is that we're going to end up using. So you guys sitting here in pharmacy school probably need as normal as 0.8 grams. I'm not sure a pharmacy student can be considered unstressed, but we're talking about stress medically. So in this case, we're talking about somebody who has had some surgery or some trauma. So our guy here is had surgery, so let's use 1.2. So don't make it overly difficult. This patient needs 1.2 grams per kilogram per day. So tell me, based off of his feed weight, how many grams of protein he needs per day. I did warn you that the math was not hard. It's just kind of the setup and making sure we can keep track of all these things that we're doing and if they make sense. So if we take 75 times 1.2 grams per kilograms cancel, and we end up with 90 grams per day. That's number 2. We're done. And we're good. And that's what our target will be. We want to give them 90 grams of protein per day. The problem here is, why did I say we wanted to give them the protein? To help build new tissues and to heal and recover. However, the body will do what it will do. And protein can be broken down as a source of calories. While we don't want it to do that, we're going to give them enough other calories that hopefully it doesn't do this, but that 90 grams will provide some calories. The body will probably break down some of it. So let's account for the amount of calories we also are giving them. If we're giving them 90 grams per day of protein, we are also providing them a certain amount of calories if the body chooses to break that down. What we do know is that for protein, every gram provides 4 kilocalories. So let's estimate then, or calculate, how many calories will come from that protein. If the body chooses to do so, how many calories will it generate from 90 grams of protein? 90 grams times 4 kilocalories per gram, so grams cancel, and we end up with kilocalories per day, 360. So while we hope the body doesn't use that, it can. So we are providing, in the form of protein, up to 360 kilocalories, all right? Which is why, before we calculate the dextrose and the fat, which are our other 2 sources of calories, we want to adjust this amount. We don't want to provide that amount because that will be coming potentially from the protein. So our new target is called non-protein calories. It's the calories we want to get from non-protein sources. So we're going to take the total we calculated minus what we just did. So remember, we calculated using the Mifflin St. Georg and modifying it that he needed 2,051 calories total per day. That was the total per day. We just figured out that we could be giving him as much as 360 kilocalories from protein. So if I subtract the protein, this is now my target for my other sources of calories. All right? And think about what you chew per day. What is a main source? If you go out and have a hamburger, would you agree some of it is protein? We got the protein. What does the bun get broken down into? That's a source of what? Sugar. What's the fancy word for sugar? Carbohydrates. If I say carbohydrates, yes, you're absolutely right. That's what I'm talking about, sugar. So think about it. We need carbohydrates, and carbohydrates are a great source of clean burning energy. We're going to maximize our energy, our calories, and get as much as we can from carbohydrates, but we can't get them all. So what is the other main food source that we haven't talked about? That's actually got a lot of calories in it, but we don't want to get a lot of it. Fat. So again, fat is a good source of calories, and we're going to use it. So for our non-protein calories, what I'm just trying to set up in your own mind, when you take protein out of the equation, the 2 main things we use to supply the rest of the calories will be dextrose, which is a carbohydrate, which is a sugar. So dextrose, carbohydrate, and fat in the form of fat emulsion. We'll provide the rest of it. Those are the 2 sources for our non-protein calories. As I said, we want to maximize what we can get through in using from carbohydrates, and that's about 75%. So of the non-protein calories that we just calculated, remember we just said we want 1691, tell me what is 75% of that? So 75% of my 1691 would be the calories I want to get from my carbohydrates. In this case, dextrose, meaning carbohydrate, meaning sugar. So that's not a hard calculation. Once again, these are not hard calculations, but 1691 times 0.75 means that's now my target for my dextrose. My carbohydrate source, I want 1268 kcal from there, which means even if you subtract the difference there, you can calculate the fat or just multiply the same total by 0.25. I need 423. Okay, so if I get 423 kcals from fat and 1268 from dextrose, do you see where those would total up to be 1691, which when you add it to my protein gives me my total of my 2000 and that I was going for, was it 25 or 2051, okay? Is everyone okay? Because we now have calculated all the targets. We know how much fluid we need. Do we know how much protein? Yes, 90 grams per day. Do we know how much dextrose? Yes, the 1200 kcals. And do we know how much fat? 423. We have the targets for each of our ingredients that need to go into our TPN. That was question 3. Targets first. So now we need to calculate volumes. All we have to do is take our targets and determine how much liquid, how much of my actual product I'm going to use to make this IV that I need to do. So again, you'll notice here in terms of protein, we use amino acids. They come in 5 different concentrations. As I mentioned for carbohydrates, we use dextrose, 5 different concentrations, and fat emulsion has 3 different concentrations. Let's just pick. You really just can pick. And you usually, if you go in a hospital, if you ever see pictures of the TPN machines, they have hundreds of bottles on there because they can choose different bottles for different reasons in terms of calculating the volumes that they need. What we're going to do is essentially choose the highest strength for those 2, but the middle one for here. Okay, so we made a choice. We're going to use 15% amino acids, 70% dextrose, and 20% fat emulsion. We chose that. And we're going to use those concentrations and our targets to determine the volumes we need to give, all right? So let's start with this. If we are choosing 15% amino acid, what does 15% mean? 15% weight per volume. What does that mean? 15 grams of amino acids for every 100 mils, right? And we wanted how many grams of protein? 90 grams. So do 90 grams, essentially divide by the concentration. See what you get, or well, I'll just set it up here. I'm kind of telling stories here. Again, I'm going to multiply by the concentration expressed as for every 100 mils, there's 90 grams. So that essentially I'm dividing by the concentration so the grams cancel. And would you agree? All I need is 600 mils. 600 mils of a 15% amino acid provides me 90 grams. Can we all do that? That's kind of basic at this point too. Hopefully you're getting skilled at this. All right, so 90 grams at a 15% means I need 600 milliliters. That volume's done. The dextrose and the fat have one additional step because instead of being in grams, remember how my protein was 90 grams? The target for my dextrose and my fat were in what units? Kilocalories. So I have to, if I'm going to start with dextrose, I have to use its conversion, and I would always provide that to you, the fact that then if my target is 1268 kilocalories, I first have to convert that to grams by dividing by 3.4, so I can calculate grams from kilocalories. Then, this is the same thing that we talked about. 70% means 70 grams for 100 mils. I want grams in the denominator, so I'm going to essentially divide by 70, multiply by 100. If I do that, I get the total volume that I need. Right, 533. Does this make sense? Could you have gone from this target and gotten that using those 2 conversions? Do you see where essentially there were 2 factors, converting kcals to grams and then using the concentration to go from grams to milliliters. So smarty pants, do that for the fat. So this is the same exact formula. I will warn you, as I mentioned, fat has a lot more calories in it. There are actually 10 kilocalories per gram of fat, especially at the 20%. So use that conversion and use that concentration and tell me, and again, our target, what was our target? Was 423, right? I'm just trying to make sure we get back here. That's your target for the fat. So we're starting with 423 kilocalories. Tell me, if I don't accidentally show you, what the volume is. 423 kilocalories converted to a volume.
Quick question on exams. Will you give us the concentration we need to use, or is it where we will have to choose?
No, absolutely. That's a good question here on an exam. I will provide you which concentrations to use. Yes, because that is a choice. Anyway, I want to go into this as you guys keep working. Oftentimes, by choosing the higher concentrations, what volumes do we have to use? smaller volumes. Less expensive from a pharmacy standpoint. So it's a more cost benefit to use higher concentrations. But there are times in clinical situations where you want to do something different. But to answer your question, I will definitely give you the concentrations to use. All right, that hopefully gave us enough time for you to go 423 kilocalories times 1 gram over 10 kilocalories, so that I cancel kilocalories. Bringing this down and saying there are 20 grams for every 100 mils means I need 212 milliliters of my fat emulsion. Dude, we have our volume now of our protein, we have the volume of our dextrose, we have the volume of our fat. We are essentially done with the main ingredients, all right? We know fluid, we know protein, we know everything we need for calories. The other thing I mentioned was, aren't there the electrolyte things that we lose through sweat and pee and everything else? So sodiums and potassiums and calciums. So separate from all everything that we've done, we now need to replace those as well. Okay. The good news is there's really only 5 main electrolytes that we replace. And the amount we need is pretty standard for everyone per day. That is, most of us need about the same amount of magnesium, same amount of calcium. Which are the 2 on the list, though, that are weight-based? There are 2 that are a little more complicated simply because the amount you need is standardized per weight. And that's going to include the sodium and the potassium. Okay, so not saying it's super difficult, but the other ones are just a piece of cake. But the sodium and the potassium, you have to factor in the feed weight there a little bit. Okay, so we'll factor that in. Getting back to the question here about, will I provide you concentrations? Absolutely, and the good news is that in hospitals, the concentrations for these ingredients are pretty much standardized. We all use the same ingredients for replacing those, so I will always provide you, and you would always know the concentrations, all right? There's one trick here, the potassium phosphate. So one of the things we need to replace is phosphorus. What is our source of phosphorus? What are you going to use to get your phosphorus from? Potassium phosphate. Do you see that it's the only ingredient in there that has phosphorus is the phosphate, and there's only one ingredient that has phosphate. Are you with me on that? So that is our ingredient. The only trick I would say is it's not just phosphate. What does it also have? Potassium. Do you see where when you have phosphate, you also get a certain amount of potassium? So the trickiest thing on the exam, when I do these on exams sometimes, is to calculate the amount of potassium you need, because potassium comes from both potassium phosphate and also potassium chloride. You'll see that as we go forward here, but that's the only trick to this. I don't want to make it more difficult than it needs to be. So let's just start with the sodium. Truly, let's go back to here. It's 1.6 milliequivalents per kilogram per day. What did we say his weight was? 75 kilograms. So calculate how much of this he needs, then use this concentration. Do you see where you need to use this and this to calculate how much milliliters? The question I'm asking is how many milliliters of sodium chloride, let me go back to the question, do I need of that additive where I gave you the concentration of 4 milliequivalents per mil? How many mils of that do I need to give him the replacement of sodium that he needs? I took my 75 kilograms. And it was 1.6 milliequivalents per kilogram, so I multiplied that. But then the concentration of my additive had 4 milliequivalents per milliliter. Since I want milliliters, I divided by 4, so that would cancel. And that's what got me my 30. Okay, 30 milliliters. And that's my answer for sodium. The only thing I have that gives me the sodium is my sodium chloride, so that's how many mils of that I'll need. Let's go ahead and do phosphate. Go ahead and calculate how much phosphate this person would need. I would remind you to go back, and I know I have to go back and do this. This phosphate was not even weight-based. It basically says, and there is a range, and I'm simplifying this a little bit, there is a range, and you would look at their labs, and you would decide whether they need higher or lower within the range. So this was a choice a pharmacist has made, okay? So within his labs, I said that he needs about 30 millimoles, and that's a different unit there, millimoles, doesn't affect anything, 30 millimoles per day. And the reason I say it doesn't affect anything is that I give you the concentration of phosphorus in millimoles. So they're in the same units there, so that makes it easier. That's a piece of cake. He needs 30 millimoles per day. I have a liquid that provides 3 millimoles per milliliter. So 30 millimoles divided by 3 millimoles per milliliter, if you will, cancels, and I get 10 milliliters. Easy enough? So we know we want essentially 30 milliliters of our sodium chloride. We know we have to use 10 milliliters of potassium phosphate because we need 10 milliliters to provide the amount of phosphate. So far, so good? So let's do potassium. Go ahead and calculate for me how much potassium he needs per day. Don't do a volume yet. This is not a volume. This is a multi-step one. So for potassium, it starts with how much does he need per day. So straightforward formula there. Use the amount he needs per day times his weight. And tell me how many milliequivalents then per day does he need based off of his weight. .75 kilograms times 1.2 milliequivalents per kilogram means per day he needs a total of 90 milliequivalents. So far, so good. What are we going to use to provide that? Well, we'll have two sources. We'll have the potassium phosphate and the potassium chloride. Which of those two do we already know how much we're using? The potassium phosphate. Why do we know that already? Because it's the volume we have to provide the phosphate. So the next step is to figure out, well, if I'm going to be using 10 milliliters of potassium phosphate to provide the phosphate I need, how much potassium will it also provide? Because potassium is coming along for the ride. So go back and look at this, the concentrations here. Remember I said there are, look at my red mess here, but I'm sorry, but essentially there is 4.4 milliequivalents of potassium per milliliter. In addition to what it provided a phosphate of just potassium, every milliliter of potassium phosphate provides 4.4 milliequivalents. So use that and the fact that we're using 10 milliliters to tell me how many milliequivalents of potassium are going to be in my 10 milliliters. 10 milliliters times 4.4 milliequivalents per milliliter means 44 are already provided by the use of my potassium phosphate. Of the 92 that I need, how much is already provided? 44. That's coming from my potassium phosphate. So the next step is to calculate, well, how much do I still need then? If I needed a total of 90, and I think if I said 92, I was wrong, I'm sorry, 90 total that we calculated. We're getting 44 from the potassium phosphate. So what our target for the potassium chloride is only the 46. Is everyone okay on that? Do you understand? I mean, we calculated 90 total, but we had to subtract the amount coming from the potassium phosphate. The leftover amount is the amount then to get from potassium chloride. And potassium chloride, if you look on that list, has a concentration of 2 milliequivalents per mil. So if I need 46 milliequivalents and divide it by 2 so that the milliequivalents cancel, I see that I need 23 milliliters of potassium chloride. Because 23 milliliters of potassium chloride plus 10 milliliters of potassium phosphate provides me a total of 90 milliequivalents per day of potassium. That's the two combined. That gets me to my total. That's the hardest part to the electrolytes. As long as that light comes on, you understand you got to just do things in that order to account for the potassium. I can't trick you on the exam when it comes to these electrolytes. That's the trickiest thing, because let's look at the remaining ones are calcium. It's pretty straightforward. It was a daily amount of 13 milliequivalents. We needed 13 milliequivalents per day. It comes at 0.465 milliequivalents per mil, so we divide by that, and we get 28 milliliters. All right? Pretty straightforward. Hopefully you kind of see that. You'll notice magnesium is the same exact way. It gave us a total daily target of 16 milliequivalents. The concentration of the additive is 4 milliequivalents per mil, so if we divide by that, so the milliequivalents cancel, we see we need 4 milliliters. So I've lost track. How many electrolytes have we done? Sodium, phosphorus, potassium, calcium, magnesium. Would you agree there are 5 of those things there? So we've calculated the volume for all of those individually. So our last step, though, is to add them all up. We're going to need to account for all of those ingredients here in a little bit. All right? So all this is once we've calculated each individual additive, you sum them all up. So add up each of the individual volumes, 30 plus 10 plus 23 plus 28 plus 4, all comes up to a total volume of 95. So by the time we've squished in all of our electrolytes, we will have added 95 milliliters of fluid. Because we're down to the last step. You know exactly how much protein, we said 600 mils, you know exactly how much dextrose, we know exactly how much for the fat emulsion. We now know we're adding 95 milliliters. Can anyone tell me what the last ingredient is? That we always calculate in these. The last thing we look for is water. Because water will be the difference between the total volume we need and all of the junk that we're adding. Does that make sense? So do you remember, what was our total fluid needs? We calculated that. Do you remember that volume, that amount that we calculated? Wasn't that the 2,600, right? So this was what we calculated the total to be. of fluid. So let's subtract the volume of each fluid additive that we're adding. So we're adding 600 mils of the protein, the 533 of the dextrose, the 212 of the fat emulsion. Then we just said we were going to subtract 95 mils for all of the electrolytes. And then I'm cheating because there are things we didn't talk about. Just realize in a daily TPN, we always usually add one dose of multivitamin. It's pre-formulated. It's got like a bunch of vitamins all together in this 10 milliliter vial. So we suck up and stick in 10 mils of multivitamin, and there's 3 milliliters of trace elements because there's vitamins and minerals. Would you agree? They're different things. So the multivitamin just has vitamins. So the trace elements is essentially the minerals part of that. So 3 mils for that. And these are kind of standard formulations. So that's where the additional 13 mil total comes. So if you subtract all of those, the final ingredient is water, and we would need 1,147. So this volume, and this volume, and this volume, and this volume would all be programmed into the pump. Pump, 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 pump. Then you get this empty bag, and it just pumps all of that fluid and measures it all out, sticks it into the bag. When you're done with that, you do your individual electrolytes, and it pumps all of that into the bag. You take the bag off, and you manually inject your vitamin and your trace elements, and you're done. You swish it all up, you send it up to the floor to the nurse, who then has to administer it. So the last calculation is, what is the infusion rate? I'll give you a second to try to do that. The nurse needs to infuse this bag. And we said this bag provides all of the nutrition they need for how long? A day. So tell me how many milliliters per hour. The infusion rate the nurse needs is a rate to infuse this bag in milliliters per hour. We said the total volume, because they're infusing the bag, and the bag has everything in it. So what was the final total volume of everything together? 2,600 milliliters. And that's going to be going in over 24 hours. So you take 2,600 milliliters divided by your 24 hours, and you would get 108 milliliters per hour. All right? And that's the end of the story.